The chair recognizes the gentleman from Virginia, Mr. Boucher.
Well, thank you very much, Mr. Chairman. More than 47 million Americans lack health insurance today, and millions more are underinsured, meaning that they simply can't afford to pay for the medical care they receive. Due to the cost shifting that comes from treating the uninsured in emergency rooms, the costs imposed on private health insurance, on Medicare, and on Medicaid are enormous and are growing each year as the numbers of the uninsured Americans increases. And society as a whole is bearing these costs. So the status quo, as Mr. Markey said in his comments, is truly unsustainable. We need to assure affordable access to health care for all Americans. The cost of taking that step will be less than the cost of doing nothing. And so I support approval by this committee and by the House of a comprehensive health care reform. But, Mr. Chairman, the bill before us is away from where I think it needs to be before it will earn my support. I am skeptical of a government-operated health care plan. I prefer the creation of a health care cooperative that would be owned and operated by its members, which would compete with private for-profit health care plans. As a nonprofit, the cooperative would effectively serve as a check on the cost of health insurance generally. Use of a cooperative instead of a public plan also would enhance our prospects within this committee of obtaining bipartisan support for the reform effort. And I really think that on a matter of this scope and this importance to all Americans, that every reasonable effort should be made in order to enlist our Republican colleagues in both drafting and passing the bill. If there's going to be a public plan, its reimbursements for health care services should not be based on Medicare reimbursement rates. The hospitals in my district in rural Virginia and across most of rural America struggle financially. Medicare does not currently pay them what it costs for them to provide patient care. They depend on privately insured patients to remain financially viable. If a public plan using Medicare reimbursement rates undermines the private insurance market, as many think it would, these struggling rural hospitals could well close. And we've had hospitals close in my rural district for financial reasons in the past. Mr. Chairman, I have some other concerns, including the need to do more to raise Medicare reimbursement rates for services delivered by rural providers who suffer today a disparity in comparison with urban areas of the country. And I very much hope that over the coming week, the committee will address these concerns. And it is my hope that we'll be able to derive a consensus that will enable a broadly supported bill to move to the House and obtain a very broad vote within that body as well. Thank you, Mr. Chairman. I yield back.
Great. Gentleman's time has expired.